Hi there. So this time around, I want us to talk addiction. Like you've been taking your opioids and now you are addicted to the drug. What do you do when you are addicted to a drug? I'll focus on opioids because where I work, that is what we treat. When you become addicted to an opioid, and you should remember most people started by taking prescribed opioids. But with the restriction in the US of these drugs, doctors, nurse practitioners, physician assistants are now restricted on how much of these drugs they can prescribe. So when people cannot get the legal prescription from a doctor, they tend to go get the drug illegally because when you are addicted to this drug, it is painful to just stop taking it. When you stop taking opioids, you go into withdrawals, and withdrawal symptoms are not very fun. No one wants to go into withdrawals. Patients who go into withdrawals will have feeling of hot and cold, runny nose, nausea, vomiting, diarrhea, crawly skin. They sweat, they are hot, they are cold, they're just miserable. Withdrawals are not fun. So, when a patient consistently goes back to taking a drug, it's because they want to stop the withdrawals they are having. So, when a patient is now taking these prescribed opioids and they do not have access to the prescribed medication by the doctor, because as I said, doctors, providers are limited on how much of this medication they can prescribe now in the US. I don't know about Cameroon if they are also restricted because in America, if you do not have cancer, pain medicine is prescribed to you short term. When you go to pain management, of course, you have a chronic pain. So you injured your back and the pain is chronic. It's there. Chronic meaning it is not going away. Back in the day, they used to just prescribe you 120 hydrocodone, take 10 milligrams every 6 hours. They give you 1 month's prescription, 120, 160 pills. And people had a lot of these drugs at home to take. But now in the US, no doctor will prescribe that to you unless it is pain management. And after a certain period of time, the DEA, which is the Drug Enforcement Administration, will start asking the pain management doctor, okay, so what is your plan with this patient? Why are you consistently prescribing this medication when you know it's not really doing much? Do you have any plans, like are they going to have surgery to help fix the problem that is causing the pain? So these drugs are now restricted, and when patients cannot have a prescription from a doctor, where do they go to? They go to the streets to get this drug. Heroin is an opioid. When you take it, it will help your pain. But the problem is you don't know what is in the heroin because it's an illegally made drug. There could be fentanyl, there could be just opioids in it. You put your life at risk, and if there's fentanyl in it, you will die of overdose, of course. And sometimes just taking too much of the opioids on its own without the fentanyl or the heroin will kill you. So, yes, addiction is real. When you take these drugs long term, you become addicted to them, and if you don't take it, you feel sick. So you keep on taking it. And that is when most people spend all of their money to buying these drugs because if they don't take it, they feel sick. And then when you build a tolerance, if you don't take it frequently, you realize if you used to stay 6 hours before you take the opioid. Now you cannot even last 2 hours and you have to take the drugs. And of course, they are not cheap. Pain pills on the streets are not cheap. Heroin is not cheap. It's cheaper than the pain pills, but it is not cheap either. So people go now and start using all of their money to buy these drugs and take them to kind of prevent withdrawals from happening. So If you're going through that, if you're going through the point in life where you've lost everything, because most addicts lose their homes, their cars, their jobs, their families. People just are tired of them doing the same thing over and over and over and not changing even when they are encouraged. But of course, us, the judgmental world, don't know what they're going through, and we don't understand what they're going through to be stuck in this addiction. So encourage treatment, because treatment works. I've seen miracles happen at my job. I had a young guy who walked in, did not even have money to pay for his visits or his medication, and I made a deal with him. And I told him, I said, you know what? Back in the day, that was like 5 years ago, they used to, the medication that treats opioid dependence, we, all of us who had could prescribe that particular medication, had a 1 year free supply that the company, the pharmaceutical company, gave us. So when this young guy walked into my office, I told him, I said, you know what, I want you to sign a contract with me. I'll give you free medication for 1 year as long as you make sure you take it, and I want you to get your life back. And that is one of my very, very fun stories, because I still get to talk to him and I still get to hang out with him. He takes me out every so often for dinner to just appreciate me for saving his life with my prescription. Not, I'm not God, so I didn't save his life. I gave him a free medication that saved, helped him get his life back. And he took his medication, recovered from the addiction, got a job, and started paying for his treatment on his own, because of course he told me, hey, I now have a job, I can afford the medication, I have health insurance, and you don't have to give me free medication, so I had to give it to somebody else. So please, treatment works. And if you're going through a difficult time with addiction, especially to opioids, that is what I'm focusing on, because that is what I treat at my clinic. Please seek treatment. There are several different medications that will help you feel better and not have those withdrawal symptoms. So it is really important to seek treatment and feel better and feel healthy again and get well from this disease that is killing people. Yes, treatment works. I've seen miracles happen, and I keep seeing more miracles happen when patients take their medication and feel better. You all have a beautiful day. I will see you soon.